I'm Dr. Sri. I'm a board certified family medicine sports medicine doctor, and in this video I'm going to share the exact same tips or the exact same advice that I use in my practice to help my patients get their uncontrolled diabetes all the way back to normal, especially from an a1c more than 9 all the way back to normal. So you will learn how I use exercise, healthy eating habits, and also briefly touch upon medications. So usually my patients are able to come off medications within 6 months to a year as they start to improve their lifestyle. Okay, so without further ado, let's get started. So let us understand what is A1C. So A1C is a blood test that measures your average blood sugar levels over the past 3 months. So it basically gives an overall picture on how a patient is managing his diabetes. So we use this test to diagnose diabetes and also to monitor its treatment. So basically the A1C test measures the percentage of hemoglobin in your blood that is coated with sugar. We call this glycated hemoglobin. And the higher your blood sugar levels are over the last few months, the higher your A1C level will be. So when your A1C is around 7, your average blood sugar is around 154. And A1C of 8, your average blood sugar is around 183. An A1C of 9, your average blood sugar is around 212. A1C of 10, your average blood sugar is 240. And an A1C around 11, your average blood sugar is 269. So before we move on, I want you to reflect for a few minutes. It is likely that your A1C level is higher, and the chances are that you might be frustrated or discouraged that nothing is working. But the solution that I'm going to provide you in this video, I know it's going to work. I'm confident about it. But the question that you have to ask yourself is that, why should you take control of your blood sugar? For some of my patients, family comes into play. For others, good health and avoiding suffering takes priority. Make sure you write down these reasons. The next time you're facing an unhealthy temptation, like let's say a donut, or hours of watching TV with a bowl of ice cream, remember those reasons and ask yourself if indulging is truly worth it. So when you start to get your blood sugar under control, you'll experience a lot of positive changes right away. So your energy levels will improve. You'll be able to sleep more soundly with fewer middle of the night bathroom trips due to higher glucose in your body. Exercise and activities becomes easier. Cravings becomes more manageable. And if you're a woman, menstrual cycles might become more regular. And that's not all. Improved blood sugar can also result in healthier gums and teeth and potentially better vision. All of this is possible with proper management of your diabetes. So by maintaining control of your diabetes in the long term, that is 5 to 10 years from now, you're setting yourself to experience a range of positive health outcomes. For example, you'll reduce the risk of kidney disease, eye disease, nerve disease, heart disease, and joint pain. Additionally, pregnant women may experience fewer complications by keeping their diabetes under control. So first of all, why is your blood sugar high? To understand this, you have to understand what is causing the sugar to rise in your body. So the first is the consumption of food, while the other is a result of stress hormones that is released from the liver. So stress hormones can be caused by various factors like poor sleep, anger, frustration. Conversely, physical activity will cause the blood sugar to drop due to its direct and indirect consumption of sugar or glucose. Diabetes medications also cause the blood sugar to drop directly or indirectly. So let us start with physical activity. Our bodies are designed to move during the day and take rest at night. Sitting is a new smoking that we are facing. One thing that I've seen in my experience taking care of patients is that if a patient improves from his baseline, so let us say improves by 50% from his baseline, I start to see improvement in blood sugar pretty significantly. So what do I mean by that? So decreasing total daily sitting time to less than 4 to 5 hours and aiming for 7,000 to 10,000 steps a day is the goal. However, let us say a patient is currently sitting for 10 hours each day. Cutting that down to 6 hours can still have a huge impact on the blood sugar control. So what would I do if I were you? So if you have a Fitbit or a step tracker, the plan to take at least 250 steps while brushing your teeth, or basically 3 minutes of walking. If you brush twice a day, that's 500 steps. So take 1,000 steps right after waking up, which is basically 10 minutes of walking. And 500 to 1,000 steps after each meal, which is basically 5 to 10 minutes of walking. That's a total of almost 3,000 to 5,000 steps already. Then do 5 to 10 minutes of walking for every 1 to 2 hours of sitting. And if you're sitting for 8 hours a day, that's almost 2,000 to 3,000 steps. You have reached almost 8,000 steps just by doing this. Try to be active as much as possible. So let us focus on food. So the first are vegetables and fruits. Usually I tell my patients the goal should be to meet at least 5 cups of vegetables and 2 cups of fruits. So let me discuss a little bit about the importance of vegetables and fruits in your diet for blood sugar control. So vegetables are highly nutritious and they contain a high amount of dietary fiber, which helps reduce the total carbohydrate content in foods. So let us say your meal contains 50 grams of carbohydrates and 5 grams of fiber. Basically, the blood sugar spike behaves like that you have consumed only 45 grams of carbohydrates. In addition, vegetables provide antioxidants, vitamins and minerals that may indirectly improve insulin sensitivity. So write down how many cups of vegetables you've had in the last 24 hours. So let's say if you had only 1 cup of vegetables, then focus on getting at least 2 cups of vegetables. And once you're able to meet 2 cups of vegetables, then increase to 3 cups and slowly keep progressing. Incorporating salad into meals is a great way to quickly add more vegetables to your diet. If you're short on time, how about chopping up some cut cucumber, celery and carrots that will make a quick snack that's full of nutrition. Add a lot of vegetables to your daily meal. Instead of having just pasta, make vegetable pasta. If you're having lentil soup like dal, add frozen veggies to the lentil soup. So come up with some ideas like this. Invest in a Mediterranean eating cookbook to learn more healthy recipes like this. So regarding fruits, aiming for 2 cups is a good idea. So many patients get concerned that the fruit can actually cause blood sugar spikes. Yes, that's true, but 2 cups is not going to drastically worsen your blood sugar control. But let's say if you're still worried about it, then I would make sure that you look at the glycemic index of the particular fruit. So to know more about glycemics and glycemic load, make sure you watch the video that is linked at the end of the video, and you'll know how to adjust eating those fruits, thereby not seeing a high blood sugar spike. Now let us talk about food timing. So food is necessary to provide nourishment and energy to your body. However, if you aren't eating, your body still gets energy from the stored fat and carbohydrates in the liver and muscles. So basically, there is no constant need for food consumptions. So let us say you have a lifestyle like me, which involves getting up early in the morning, exercising, staying active throughout the day, and then having dinner before bedtime. Then I would avoid carbohydrates after 5 p.m. or 6 p.m. Your body does not need those glucose spikes unless you're going to exercise after 5 p.m. or 6 p.m. So you can either choose to go without dinner or opt for a meal that is low in carbohydrates. For example, you could have salmon with broccoli, or sambar with vegetables, or dal makhani with some cucumber salad, or tom yum goong soup. So these are all my personal favorites. Now let us talk about carbohydrates. So substituting complex carbohydrates for simple carbohydrates will have a positive impact on your diet. For example, refined white rice and flour-based products have undergone extensive processing, which strips them of essential vitamins and minerals as well as fiber. So this then causes the sugar levels to spike quickly. Many Indian snacks are similarly high in refined carbohydrates and saturated fat, a contributing factor to heart disease. So complex carbohydrates should be consumed instant. So these include millets, quinoa, ragi, brown rice, and other unrefined foods. So the key to maintaining health is portion control. It is also important to keep an eye on the glycemic load and the glycemic index of the foods. I'm going to link a video at the end to understand about glycemic load and glycemic index. So what is something that you should focus on quitting? So simple sugars such as sodas, fruit drinks, Faluda, canned fruity, canned badam milk, anything that has added sugars in it. Is it easy to quit? No. But can you quit? Yes. So remember, sugar craving is also like an unconscious habit like smoking. So let us say I'm working in front of the computer and suddenly a thought enters my head saying that, okay, let's have some sort of a donut, right? So it's just a thought. You don't have to pay more importance to the thought. So let's say you watch the thought, and let's say you watch the thought go away and you just continue doing the work. But let us say you're stressed, and some people can have stress-induced eating. So then you want to divert from the stress. So you want to have some sort of a sugar. So in that scenario, try to focus on some sort of breathing exercise. So maybe pause for a moment, take a deep breath. So in and out, maybe for like 2 to 3 minutes or so. And after that, the stress goes away, your mind is at peace, and you can start going with the work. But let us say if you have real hunger, then in that case, just let's eat a real meal. So this way, once you bring consciousness into everything, it's easy to quit sugar. So now finally, medications. So let us say the patient's A1C is more than 9. I usually talk about insulin. The reason I talk about insulin is that studies show that when your glucose is really high for quite a long period, that particular glucose is actually causing some damage to the beta cells of the pancreas, which is where the insulin is being produced. So we basically think that there's some sort of insulin deficiency going on, and medications alone may not help at this time. So that's why we talk about insulin during that time. But one thing that I'll tell here is that there are so many patients of mine who have gone onto insulin and they have come off insulin within like 6 months to a year or so. So just because you'll go on insulin doesn't mean that you're going to be insulin forever. Once you change your lifestyle and stuff, the insulin will fall off. But there are some patients that have tried oral medications, especially if they've not been on any medications at all. Yes, the oral medications work. I usually give the trial for around like 3 months or so, and if they're able to bring the A1C back to normal, maybe from 9 to 7, then yes, then we focus on getting the medications, basically kind of like help drop off those medications as they continue to improve their lifestyle. But let us say if you're type 1 diabetic, or let us say if you have other types of diabetes, such as like maybe maturity onset diabetes of young, and if you're on insulin, the chances are that you may not be able to come off insulin completely. And that's fine, but still you'll be able to cut back on the insulin, which is still more important for your health. So follow these tips, and I'm pretty confident that you can get your blood sugar under control. If you do, please make sure you put in the comment box below. If you really enjoy this video, if you feel like this video can be helpful for other people, please make sure that you share this video too. If you want to thank me, please make sure you click the like button, and please put some appreciative comments in the comment box below. And I'll see you in my next video. Until then, goodbye.